Welcome to the final day of the World Parkinson Congress. I have reached Friday and it's been a really great day, and it's actually been one of my favorite days because we were talking all about the power of exercise as medicine if you have Parkinson's disease. So I know that there are a lot of new evidence out there about medication and surgery and stem cells and all this stuff, but today's highlight was really all about what can we be doing now in order to help you manage your Parkinson's symptoms in a better way that isn't just waiting for a cure. So I went to quite a few seminars today. I went to the first seminar that is talking about exercise as medicine. Are we waiting for a cure, or is there care that can be done in between? I went to an awesome exercise class by one of my favorite nonprofits in Austin called Power for Parkinson's. If you haven't checked them out, I highly encourage it. But I want to dive deep into what I learned today and have a lot of tips for you, a lot of great strategies that you can use to be more active and get more exercise. And as a physical therapist, I obviously feel like this is incredibly important. So before we get into that, if we haven't met yet, my name is Sarah King. I'm a physical therapist that specializes in Parkinson's disease. I have a practice in Austin that I own and operate called Invigorate Physical Therapy and Wellness. It is my baby. It's so much fun. I help people with Parkinson's create a Parkinson's exercise program that helps them get their life back. And one of the biggest components that I use is exercise. And exercise in a way that's specific to Parkinson's, that's fun, that's intense, that's targeted toward your goals and your abilities. And so what I wanted to do today was talk you through all of the seminars I went through about exercise. And at the end, I have a really great eight resources or 8 tips that you can use to integrate exercise into your daily life that one of our speakers told us today that I thought you could walk away with. So the first seminar I joined today was called Care versus Cure, and it was a panel of physical therapists, movement disorder specialists, a couple people with Parkinson's, and so it was a good variety of talking about are we searching too much for a cure and we're forgetting about how to care for all of you who have been diagnosed with Parkinson's right now? We focus so much on finding a cure, and I believe there's grounds for finding a cure for Parkinson's. I would love if one day I had no job. I literally had to shut down Invigorate because there was a cure for Parkinson's and I had no one to treat. That would be literally the best day of my entire life. Until then, I am really working hard to help people get their life back with a plan and a strategy that they can use now while they are waiting for that wonderful day to happen. So we had Terry Ellis, who's a physical therapist here in the States. We had Pamela Quinn, whose name you guys might notice and recognize. She does a lot of dance for PD. She's also a person with Parkinson's herself. We had Sarah Regare, who's from Sweden, also a person with Parkinson's, and Peter Fletcher, who's a movement disorder specialist. We also had John Falderman, I always say his name wrong. He's the one who wrote Brainstorms, a really awesome book for people with Parkinson's, and if you just want to understand more about the life of someone with Parkinson's, Brainstorms is a great book. And so we kind of had this panel discussion about how we can focus on caring for you guys. So the question was, well, we're searching for a cure. What are we doing to help the people's quality of life if you have Parkinson's? And really what kept coming up, and this wasn't planned or planted, but the power of physical therapy and exercise. As a person with Parkinson's, or maybe a caregiver, if you have Parkinson's, you're probably spending 1 hour of your life out of the entire year, maybe at your neurologist's office, and that's 1 hour out of 8,760 hours. And so while you're in the office, that's great to be present while you're there, but what do you do the other 8,759 hours of your year? Well, you have to care for yourself. And the best way to do that, they're finding and they've found, is through exercise. And so as a physical therapist, the role of a PT and the rehab team is to provide you guys with resources that you can use not only in the short term to help you with any immediate issues you're having, but in the long term, how to build out your plan. And so if you're working with a therapist, or any type of Parkinson's professional, it should start at diagnosis, and it should be tailored to you for your entire life. You should be going in there with a goal, and setting a goal for your appointments for the short term, but also checking in every 6 months, every 12 months, updating your plan. Your physical therapist is your lifelong partner. You guys are going to be in this together from day 0 to the very last day, because there's always things that can be tweaked and changed. And so we really need to help you guys access more resources from that whole spectrum, working one-on-one with a physical therapist all the way to integrating into the community, finding a community program that works for you guys. And another part of that is this home exercise component, where you have a program that works for you, but you're wondering how to do it on your own. Maybe you're not very consistent with your home exercise program. I won't call out any names, but something that I'm really excited about as a complete side note is this online booster program that I'm launching next week. Just a really quick plug. I won't launch into this because we've got more to talk about, but it's 5 weeks, it's online, it's fully supported by myself and my team. It's completely video based. You just click one button, pull it up, follow along with some of the exercises. I know some of our boosters are watching this video because I've seen them in the comments already. People have gone through this program and they feel supported at home doing the exercises. They can actually do Parkinson's specific exercise in their home, and with the full support of a team who's there for you. So holding you accountable, encouraging you to reach your goals. And so that's a quick booster plug, but I'll come back to the World Parkinson Congress. So we had a question and answer with this panel, and one of the questions was actually about medication. It was directed to the movement disorder specialist, and the person with Parkinson asked, shouldn't we be able to self-medicate to some degree? And her issue is talking about, I know my body, and I'm with myself 24/7. So sometimes I know that I need a little bit of extra dopamine, or whatever medication, in the mornings or in the evenings, or if I've been too active or not active enough. Shouldn't I be able to say, it's my body, I know what I'm feeling, and I can up or down my dopamine as needed? And if you are one of those people, actually the movement disorder specialist, he said, actually, I totally encourage my clients to do that. But here's the thing, if you're gonna kind of play with your medication to that small degree, you need to write it down so that when you go see your neurologist or your movement disorder specialist, they have feedback. So you guys can work together to see maybe to uncover any patterns and to work together, because it's a two-way relationship, or at least it should be. If you have a good neurologist, they should be listening to you as much as they're talking to you. So if you're one of those people who's been like, I feel like I can kind of self-adjust some of my medications, you might be safe to do so. You want to make sure, it's okay to chat with your movement disorder specialist first, but I thought that was a really cool point that was made in that session. And so that was a lot of the first session I went to. Something else that came up was this idea of Parkinson's wellness centers all across the United States that people can walk into and get great exercise programs. It's accessible no matter where you live. I know some of you are tuning in from all across the states, all across the world, and maybe you don't have access to those resources, but there's an initiative put together by a combination of professionals, Becky Farley, Jill Carson up in Canada, Karen Jaffe in Cleveland. A bunch of people are putting together this petition, which you're welcome to sign, that just says there are people with Parkinson's that need resources, and I support them getting the resources they need. They haven't formalized in a plan, I guess, but it's just saying all of these people are saying we need an answer, and it's just kind of the beginning. So if you want to sign that petition, you can go to powerforlife.org/path. It's PWR, the number 4, life, life.org/path. I would encourage everyone watching this to go sign that after you finish watching the video. Don't dive away from me quite yet. But that's going to be a great thing in our future, just to have a more Parkinson specialized movement centers that people can go to and find community. So that was our first session. And then I dove into the next, and what I think was honestly the greatest session since I've been here, and I'm biased, but it was exercise as treatment for Parkinson's. And if you're watching this, you probably also agree that exercise is incredibly powerful. I see Mark here commented, my wife Beth does her power moves every morning, and we box with Rocksteady 2 to 3 times a week. We have big believers in exercise here, so this is probably not going to be anything y'all haven't heard, but there was a lot of unique insights and tips that went into this presentation. And so the first woman that presented, Dr. Petzinger, is a neurologist from USC, University of Southern California, and she just talked about the goal of exercise is neuroplasticity. Neuroplasticity is a really big word that says your brain has the ability to reorganize itself by forming new connections throughout your entire life. If you're, 79, your brain's still reforming at 80, because that's what our brain does. Your brain learns what you need to do to survive. If you're not doing it, then if you're not doing it, your brain's not getting any stimulus, and your brain, you'd be dead if your brain stopped getting stimulus. And so if you don't stimulate your body in a way that makes it change, then it won't change. And that's what neuroplasticity is. So, exercise helps form these new connections. It's neuroplastic. It also improves your quality of life. It improves your gait speed. It improves your freezing. It improves posture. It improves balance and stability, executive functioning and cognition, your handwriting. People walk into an exercise class with great or awful handwriting and out with great handwriting. And it also helps to slow the progression of the disease. That's this evidence that's coming out. It's been out for a really long time. If you're exercising with Parkinson's, you're going to be better off in the long run. It's just like no questions asked. And what was really interesting about a study someone did is if you don't believe exercise is going to help you, you're a lot less adherent. So I just want to take this second. I'm speaking to you if you're an exercise critic, I guess, and you don't believe in exercise, you need to exercise. If you have Parkinson's, you need it, and I'm sure people can give thumbs up if they agree. So what happens with exercise is it doesn't actually change your dopamine levels, but it does change your brain's ability to absorb that dopamine. Actually, not even in your brain, in your body too. And every cell that you have, the more you exercise, the better absorbed your dopamine is. So we talked a little bit about exercise type. You guys ask me often, what kind of exercise is best? What kind of exercise should I be doing more than the other to make sure that I'm doing everything right? Well, my opinion about that by now. It just needs to pass that 7-item checklist. But what they found is when you combine higher intensity exercise, like aerobic exercise, with some type of cognitive challenge. So the example was putting a mouse on a wheel, making them run, but also taking out some of the slats in the wheel and making them jump from one slat to the other and kind of challenging their brain. So they're getting the aerobic exercise and they're getting a mental challenge. And those people had significant increased blood flow to their brain. The security guys are coming after me. A significant increase in blood flow to their brain. And thus more improvements in cognition, more improvements in motor control, more improvements in coordination. Everything got better when your brain is flooded with oxygen and blood from aerobic, challenging exercise. So if I've got you pumped up by now, just hop up and do a few jumping jacks, because I feel like I'm really jacked up. I could go exercise right now. Okay, so something also that was interesting is people always ask me, it's just so uncomfortable to get out of breath. I hate that feeling. And so I want to tell you something I learned that can help you next time you're feeling really out of breath. I know we've got a couple people here who just started on a treadmill. You're feeling short of breath. You're feeling like it's really hard. Well, when that's happening, your cells are actually, quote unquote, short of breath also. They're running low on oxygen. When they run low on oxygen because you're working out really hard, you start to release chemicals that help you boost your metabolism, regulate your blood sugar, build new blood vessels, and protect your cells in the future. So next time you're like, oh my gosh, this is so uncomfortable, I'm really, really out of breath, I can't breathe. Of course, there's a safety component to that. But if it's just really hard, know that your cells are literally changing your body. You can feel that in your body. So keep going. Stay safe, obviously. But, getting short of breath can actually trigger so many protective mechanisms. And Mary says, just do it. That's fantastic. I agree with you, Mary. Just do it. Okay, so then we came to Dr. Earhart, and who talked about the practical implications of all this research, how you integrate exercise into your everyday life. And she talked a lot about actually planning your exercise. So if you guys plan your exercise, you can just give me a thumbs up or tell me what you do, but planning your exercise increases your activity level, even if you already exercise regularly. So this is actually something that I integrate in my practice personally. I give my clients a schedule and say, I want you to fill out what you're going to do and when you're going to do it, because I have seen that it improves, confidence actually, and then adherence to your program, because you have a schedule and you're supposed to be exercising. You could even exercise 3 times a day for 10 minutes and get the same benefits as a 30-minute workout. So break it up, plug it in, schedule it out. Your brain likes it, your body likes it, and you're going to be more successful in the long run. Okay, so then we come to the 8 tips that she gave for increasing your, or kind of integrating your exercise into your daily life. Because I know I hear a lot of people say, I'm just too busy to exercise, or I can't find time. And my first message to you is you are the most important person to you, and so you need to prioritize it, because it's the best thing that you could possibly do. So you need to put yourself above everything else, and I'm giving you permission to do so. But when life gets busy, I understand. These 8 tips are going to help you integrate exercise into your daily life. So you ready? Number 1, expect exercise to help. If you expect exercise to help you, it will help you more. And so I want you to just take this moment and just believe it is a fact that exercise is going to help you. Let's just knock all the negative vibes out of the room. As soon as you believe exercise is going to help, it also helps you adhere to your exercise program. Okay, number 2, be confident. You guys can do whatever you set your mind to, and even if you start slow and move up every day, every move, every minute that you're exercising, you're getting stronger. So just praise yourself for what you can do. Add another minute the next day, add another repetition the next day. Before you know it, you're an exercise pro. Everyone started at 0, so you're not alone, but you can catch up with everybody else, I promise. Okay, number 3, ask an expert. So whatever Parkinson's expert you have in your life, I obviously highly recommend a Parkinson's trained physical therapist, a movement disorder specialist, someone who knows Parkinson's front, back, sideways, inside out, and upside down, because they're going to help you tailor a program that's specific to you. You are very different than the next person that has Parkinson's, thank goodness. And so what you need is different than what the next person needs. You might have some type of joint pain, the other person might have some type of anxiety. Everyone's symptoms are different. So seek out the experts in your life, sit down with them and make a plan and revisit them often. It's not a one-time thing. It should be going to your physical therapist, should be like going to the dentist. You go every year. And I say that not having been to the dentist for over a year, so guilty. I will do it if y'all will do it. Okay. Mark says 1,000-mile journey begins with a single step. You are so right, Mark. That is true. Okay. So then we have number 4, which is to integrate exercise into your daily life. You should put it on a calendar and block that time off. That's pretty self-explanatory. Just print out a piece of paper that's Sunday through Saturday. Check off the times of the day that you're going to exercise. Make it a priority. Okay, number 5, break it into chunks if you need to. So like I said, you can do 3 sessions of 10 minutes of exercise and get the same benefits as 30 minutes straight of exercise. So I remember one of my boosters, who I won't name names, but she asked me if she could break it up. Morning, afternoon, and evening. And if you want to do that 10 minutes a day, or 10 minutes a session 3 times a day, go for it. Work out hard and get it done. Okay, number 6. Exercise in a group or with an accountability partner. This is something that you've probably heard me hear or talk about quite a bit. You need that accountability. Especially with Parkinson's, that apathy can take hold really easily. The gunnas is what we talk about. The gunnas, I'm gonna get up, I'm gonna go do my exercise program. Well, when you have somebody holding you accountable to your gunnas, you're gonna do it. So find a group exercise program or an online program or an accountability partner. You need somebody to hold you accountable. So making that a priority is the tip number 6. Okay, number 7, technology is your friend. And I know I have a lot of people on here who find technology a little scary, although if you're tuned in here, you probably don't think it's that scary since you're on Facebook watching a video. And if you can do that, you can do any other technology that's out there, I promise you. So whether it's an app that keeps you accountable, I know there's lots of walking apps that some of my clients use and beyond, a Fitbit watch. I'm happy to tell you about the booster program here in a moment, but technology is your friend and it's there to help you. And if you're not confident with it, find a helpful friend that can help you get it set up, because it can really hold you accountable and keep you going. So, and then the 8th and final tip is make it fun. I am such a believer in making it fun. If you are doing something that you hate, it doesn't have as much benefits for your brain. So, think back to a time when you were the most active or you were enjoying what you were doing the most, and start there, whether it's dancing or boxing or just walking outside, getting on a bike, getting on a canoe. I know in the booster program, one of our ladies, her goal was to get back onto a sailboat. She wanted to be able to stand on a sailboat and balance on a sailboat. Shout out to you, Patty. But she did it. She got back on the boat by working hard. So you have to go back and find something that's fun to you and, obviously have those goals to motivate you through your exercise program. So the reason why I was so excited today to hear about all these speakers talk is because, as I mentioned before, I'm launching the online Parkinson's booster program on Monday of next week. I am bringing in people from all across the world. It's a completely online, fully supported Parkinson's-specific exercise program that's 5 weeks long. You're guided day by day by day. I tell you what to do, when to do it. There's videos to follow along with. It has a start point and an end point, but it's a program that you could repeat and do forever. You literally could finish the 5-week program and put it on repeat and do it again and again. And the reason why I'm just really excited about it is because throughout this entire conference, I've been hearing about people have been talking to me, people with Parkinson's, caregivers. I just can't be accountable. I know exercise is important, but I tell you what, it is hard to do, and I believe you. There are some people who are just very intrinsically motivated, but there are other people who need help. So I'm happy to provide that, obviously. So right above this video or below it, there's a link to a waitlist, sign up. I'm going to open the doors for everyone to register and come aboard on Monday. But if you sign up via the link that is above this video, you'll be notified first of when the doors to the program open. So if you want to be a part of it, I would love for you guys to be part of this tribe. As I said, you get email support from me. You get into a private Facebook group where I'm going to be in there every week live answering questions. You get email access to me. So it's online and it's at home, but it's integrated and you're supported and you have a community, because we know that having a community to rally around you and ask questions and support you is super, super important. So you're probably watching this because you couldn't make it to the World Parkinson Congress, or something held you at home. Maybe you just don't have the resources to get there. So giving you a program in your home just unleashes so many abilities for you. So if it's something you're interested, again, the link is above or below this video. It's invigoratept.com/booster, and I would be just ecstatic if you came aboard and gave me some feedback. So I finished up today with Power for Parkinson's exercise program, and right before I went in there, I actually got to meet one of the boosters who has gone through my program, Roger, before I went in there. And Roger will be the first to tell you that exercise is the most important thing. And so it's just great to see people back out in the community doing what they love, accessing the community, and just really having a great time and enjoying each other's company after, getting back on track with exercise. So as you guys can obviously see, I'm very jazzed up about the World Parkinson Congress and about the booster program and just about all of you guys in general. So as we wrap up the last day of the World Parkinson Congress, I just want to say thank you very much to all of you who tuned in every night to say hi and to listen. Something I've learned at this conference is the people who are the most invested in their health, the ones who are most eager to take charge, the ones who say that, I'm not going to wait for somebody to have a cure for Parkinson's. I'm going to figure out what I can do now. I'm going to figure out what I can do today and tomorrow, and I'm going to feel better, and I'm going to get back to the life that I love. You are listening to this video. If you didn't feel that way, you wouldn't be listening right now, especially probably 30 minutes in at this point. So I just want to commend you for tuning in, for taking charge. I care so much about you guys and your health and your life. If you have any questions about the booster program or the World Parkinson Congress, or even just finding a skilled physical therapist in your area, I'm happy to help you. So shoot me a message via Facebook and or an email, and I'm happy to help you out in any way I can. So I see some comments rolling in. I just love all the feedback. You guys have been so awesome. So hopefully I will see you guys again soon. I will do more live videos next week, but in the meantime, head over to invigoratept.com/booster, because we're going to be opening the gates and just bringing everybody in next week. So I cannot wait to see you guys then. Until then though, have a great week, and I will see you later.